Hello, my name is Adele and I'm one of the physiotherapists here at Ashford Hospital. This short video will outline information and exercises to assist your recovery following your knee arthroscopy. A knee arthroscopy is a keyhole procedure during which your surgeon may assess and address a variety of different knee problems. The information and exercises outlined in this video provide general advice following a routine knee arthroscopy. Always follow all advice and instructions given to you by your surgeon. Unless your surgeon has told you otherwise, there is usually no restriction to walking or weight bearing following a routine knee arthroscopy. This means that in most cases, no crutches are required and you should aim to walk as normally as possible, trying not to limp. If you usually need a walking aid like a stick or a walker, please continue to use it as normal. Immediately after your arthroscopy, we recommend limiting your walking to short distances around the home. Over the next 2 to 3 days, try to walk short distances and spend a little more time on your feet while taking intermittent rests in between. Try to pace yourself and walk within your comfort levels rather than pushing through pain. Over the next 1 to 2 weeks, you should aim to gently and steadily increase your walking and the time that you are spending on your feet until you feel that you are back to your usual levels of daily mobility. Even if your knee feels good, it's very important that you avoid any sharp twisting or jarring movements and do not resume running, jumping, sport or high impact activities until after you've spoken to your surgeon at your post-operative appointment. It is also important that you check with your surgeon before you resume driving a car. If you routinely use a pool or go to hydrotherapy, please discuss this with your surgeon before returning to these activities. Many patients find that by pacing their walking and activities over the day, they are able to minimise their discomfort. Your doctor will advise you about the use of pain-relieving medications, and they may provide you with a script if required. You may wish to consider completing your exercises approximately 30 minutes after having pain relief, as this is when many people find their pain relief is most effective. It is also recommended that you use ice packs for the first couple of days to assist in reducing pain and swelling around your knee. Never place an ice pack directly on your skin. Ensure the ice pack is wrapped in a towel and then place it on your knee for about 15 minutes, roughly every 2 hours during the day. During the first couple of weeks, you may find it helpful to use ice packs after doing your exercises or after walking to help reduce swelling and discomfort associated with activity. The nursing staff will provide you with a piece of compression bandaging to wear once you're allowed to remove the bulky outer bandaging. The stretchy material will help to reduce swelling and provide gentle support, and can make activities such as walking more comfortable initially. It should be firm but comfortable. If you notice any red marks or see it cutting into the skin, please remove it immediately. You can stop wearing the compression bandage once you're walking comfortably and your knee swelling has reduced. In addition to walking, it is recommended that you complete a gentle exercise program at home. The exercises will help you to regain normal knee range of movement, improve circulation and prevent blood clots from forming, and help strengthen the muscles around the knee. These exercises are in the knee arthroscopy physiotherapy exercises sheet, which your nurse will provide you with on the day of your surgery. It is important that you practice each exercise within your comfort levels. It is normal to feel some mild tightness or stretching during the exercises and some mild discomfort afterwards, but you should not be pushing through pain. By practicing gently but diligently, most people are able to regain good movement and strength. We generally encourage people to practice the exercises between 3 and 5 times per day and to keep practicing them until your post-operative follow-up appointment. We will now go through the exercises. You may like to follow along on your sheet or have a practice yourself as we go through them. The first exercise is the foot and ankle exercise, where you should pump your feet backwards and forwards. You should perform this exercise on both feet and aim to start as soon as you remember when you wake up following your operation. This helps to get your circulation going to help prevent blood clots from forming. Aim to do at least 10 pumps of both feet every hour that you are resting during the day. If you notice that your calf muscle becomes red, swollen, warm, or painful to touch or stretch, please contact your surgeon for advice. The next 4 exercises should be practiced when you are lying on your bed. To perform the straight leg raise, bend your good leg, placing your foot on the bed, and then lift your operated leg off the bed, keeping the knee as straight as possible. Hold for 5 seconds if you can, and then gently lower your leg back to the bed. You should feel this working the muscles in the front of the thigh. If you feel any pain in your back during the exercise, do not continue with this exercise. Next, roll up a towel and place the roll under the ankle of the operated leg. Relax and allow your knee to straighten. You may feel stretching along the back of the knee. If you don't, you can add some gentle pressure using your hands by pushing down on the front of your thigh. Do not push to the point of pain. You can hold the stretch for up to 5 minutes if you remain comfortable. Start by holding the position for a minute or 2 and then gradually add time as you feel able. It is important to get the knee bending well again. Practice bending the operated knee by sliding your foot along the bed. Unless your surgeon has told you otherwise, you should aim to bend your knee as far as you feel comfortable. It is normal to feel some tightness over the knee, especially in the first day or 2 when you still have the outer bandaging on. Just bend your knee as far as you feel comfortable. The inner range quadriceps exercise will help to further strengthen your thigh muscle. Place the rolled up towel underneath your knee so the knee is resting on the towel. Straighten your knee and lift your foot off the bed whilst keeping the back of your knee on the towel. Hold for 5 seconds and then gently lower your foot back to the bed. Remove the towel at the end of the exercise and avoid resting for prolonged periods with the towel under your knee. It may be comfortable, but it can cause tightness at the back of your knee that can be hard to reverse down the track. The last 2 exercises should be practiced when you're sitting in a chair. To perform the knee extension exercise, lift your foot off the floor and straighten your knee as much as possible. Hold this position for 5 seconds and then lower your foot back down. You should feel this working the thigh muscles on the front of the leg. The final exercise helps to improve your knee bend. Draw the foot of your operated leg back towards the chair as far as you feel comfortable. You can then cross your good leg over the front of the operated leg and use the good leg to help bend your knee further as far as you feel comfortable. Hold this position for 5 seconds and then relax both legs. If you are having surgery on both knees or have pain in your other leg, you can use your hands to help bend the knee further. You can still use stairs if required, but if you can minimise the number of times you are going up and down the stairs in the first 2 to 3 days, this will help to keep you more comfortable. Initially, you will find it easier to just take 1 step at a time, placing both feet on each step. The most comfortable method is to go up with the good and down with the bad. So going up the stairs, you will step up first with your good leg and then bring up the operated leg. Going downstairs, you will step down first with your operated leg and then bring the good leg down onto the same step. Keep repeating the pattern until you get to the top or bottom of the stairs. So that was up with the good and down with the bad. Please remember that it is important that you follow any specific instructions and advice given to you by your surgeon. We hope you have found this information helpful and that it allows you to be moving well as soon as possible.